Hello everyone, welcome to the medical recap. I hope you're doing good. In today's video, we're gonna talk about pericarditis and pericardial effusion. Here is an overview of what we are going to cover today, going from the general definition and reminders to the medical picture and the treatment. Lass uns anfangen. Pericarditis is simply the inflammation of the pericardium. But what's the pericardium? Here is a little anatomical reminder. The pericardium is a fibrous sac that encloses the heart and the great vessels. As shown in the picture, it consists of three layers: visceral, parietal, and fibrous layer. Between the visceral and the parietal layers, we find a potential cavity that contains a small amount of fluid. If the quantity of the fluid is abnormally increased, the patient is going to suffer from pericardial effusion. Well, looks like the pericardium is causing a lot of problems. However, it has an important role in reducing friction against other organs, facilitating heart movements, and more importantly, protecting the heart against infections. But what causes the inflammation of the pericardium itself? Well, we have 5 causes. We believe that viral infections are the most common cause of pericarditis, more precisely Coxsackie B virus and SARS-CoV-2 virus, either simultaneously to the respiratory symptoms or after several weeks of the infection, which explains the huge number of pericarditis reported as idiopathic. Bacterial infections too can be a common etiology, with bacteria like Staphylococcus aureus, Streptococcus pneumonia, and Mycobacterium tuberculosis. Autoimmune diseases take their part in causing pericarditis as well, like SLE, rheumatoid arthritis, or Dressler syndrome. Uremia can... Hey man, slow down. What's Dressler syndrome? Oh hey Uz, very good question. Dressler syndrome is a pericarditis following a myocardial infarction due to an unknown autoimmune mechanism. We believe that the immune cells, while cleaning the infected area, can trigger an autoimmune reaction against the functional protein of the pericardium surrounding the infected area. If this reaction doesn't get controlled and extends to a bigger surface, it causes pericarditis within 14 days to months post-MI. Is it clear, Uz? Okay. Uremia can also cause pericarditis. Well, you might know that high levels of uremia can irritate multiple tissues in the body, and the pericardium is no exception. The major cause of uremia is chronic renal disease. The last cause is neoplasia, either by contiguity like lung cancer and breast cancer, or by systemic ways like non-Hodgkin lymphoma. So, as a quick recap, the 5 common causes of pericarditis are viral and bacterial infections, autoimmune diseases, uremia, and neoplasia. Enough with etiologies, let's move to the clinical picture. You are in the ER, a pericarditis patient is gonna come up with a characteristic chest pain, which is substernal, sharp pain radiating to the trapezius muscle. Leaning forward and sitting up eases the pain, while deep inspiration, cough, and supine position worsen the pain. It's related to the position of the fluid surrounding the heart. While auscultating the patient, you will find a friction rub, which is a sandpaper rubbed on wood, similar sound. Well, that's true. Saying this feels like we are in the 90s. Forget that description, I'm gonna play the sound for you. In the case of a large pericardial effusion, you may find Ewart sign, which is the result of lung compression by the heart. It consists of dullness to percussion in the left lower lung field, associated with increased tactile fremitus in the same area. For the ones wondering, tactile fremitus is the vibration of the chest wall that results from sound vibrations created by speech or other vocal sounds. We usually ask the patient to say 99 repeatedly while palpating the chest wall comparatively. It's part of the lung physical exam as shown in the picture below, and this should be your sign to go revise your semiology. If you find this a lot to remember, just focus on the characteristic chest pain and the friction rub, and you will logically suspect a pericarditis, which leads you to run an EKG and an echo. In the EKG, you're gonna find a diffuse concave ST segment elevation associated with the PR segment depression as shown in the picture. You should know that the EKG can have other variations, depends on the timing. In case of a large pericardial effusion, you may find a microvoltage and a phenomenon called electrical alternance, which is an alternating QRS amplitude, as shown in the picture, explained by the myocardial contraction fighting against the fluid surrounding it. An echocardiography can confirm your diagnosis by showing a thickening in the pericardium or a pericardial effusion. In case of a large pericardial effusion, we can find a swinging heart phenomenon, which is the visual version of the electrical alternance phenomenon found in the EKG. You may run some biology testing to confirm the inflammation process like a high CRP and SED rate. Well, I know this is a lot to cover, glad that you noticed, so I'm gonna sum it up for you. To confirm the diagnosis of pericarditis, you need 4 criteria. 1. A chest pain, which is substernal, sharp pain radiating to the trapezius muscle, a friction rub in the auscultation, a pericardial effusion or a thickening of the pericardium in the echo, and a diffuse concave ST segment elevation associated with a PR segment depression. One last step of our video, and the most important one. How are you going to treat your patient? Well, you don't. You call the cardiologist and he will take it from here. But you should be aware of the treatment possibilities. First of all, the patient needs to avoid physical effort. Medical treatment consists of B therapy with a huge dose of NSAIDs, aspirin or ibuprofen to fight inflammation, associated with colchicine to fight recurrence. You should avoid using steroids because studies have shown that they cause a high risk of recurrence unless you have a contraindication of NSAIDs like peptic ulcer or chronic renal disease. Remember that chronic renal disease causes uremic pericarditis. In case of purulent pericarditis or growing effusions, you may need to consider a pericardiocentesis, which is a medical procedure where fluid is aspirated from the pericardial cavity using a needle and a catheter, as shown in the picture below. So, as a quick recap, pericarditis is the inflammation of the pericardial layers protecting the heart. The most common causes are viral and bacterial infections, autoimmune diseases, uremia, and neoplasia. The clinical picture consists of a characteristic chest pain and a friction rub. The diagnosis can be confirmed by running an EKG and an echo. Treatment is based on NSAIDs associated with colchicine. That would be all for today's video. Do you have any questions, Us? Yeah, I have one. What are the possible complications of pericarditis? Good question. We have 2 main complications. Cardiac tamponade, which is when the quantity of the fluid is really huge, and chronic constrictive pericarditis, which is when the inflammation leads to the fibrosis of the pericardium. The complications will be the subject of our next video. Hope you enjoyed. You can download the material and the mind maps used in this video following the link in the description box. Thank you all and bis zum nächsten Mal.